This is the story of an ambitious program that began a decade ago. The story of a movement to bring about change. The story of trying to be a good friend to the community. Vidya is an Anganwadi worker. She begins a typical day with making her way to the Anganwadi center. At the center, her helper has just about started making all the preparatory arrangements. The worker promptly takes over and sends her helper off to fetch the village children as she settles down to fill her attendance. A few minutes later, the kids troop in and it's time for the morning prayers. The next hour or so is spent taking them through a series of activities to stimulate physical and mental growth. By then it's time for distributing food supplements for meeting part of the nutritional requirements of the children. She then quickly packs off the children and completes the rest of her substantial paperwork. Her job profile also includes 5 mandatory house visits a day, weighing all children once a month, imparting life skills to adolescent girls of the village, conducting meetings with local women's groups, and gathering and sending up information from the village related to a host of government schemes as instructed from time to time, besides completing her own routine reports. The A&M of the health department is equally loaded, and in most instances visits any of her outreach villages about twice a month, often only on the immunization day. She has meetings to attend, forms and reports to fill, besides running clinics at her sub-center village. Talking quietly to mothers and counseling them how to feed and care for their children is a top priority for neither the A&M nor the Anganwadi worker. And yet, it does not seem fair to ask either of them to do more than they already are doing. It was in response to this situation that in 1997, CARE introduced community volunteers who were to be known as change agents. The inspiration certainly came from successful community health worker programs in several parts of India and other countries. It was reasoned that volunteers, well trained and supported, would be able to devote time and energy to the complex and culturally demanding task of initiating and sustaining behavior change in the communities. Most importantly, they were expected to reach out to a large number of families who were often excluded from critical health information, and support the Anganwadi worker and A&M in maximizing utilization of services.
What we have experienced over the years that there was no public participation. Anganwadi worker, she is working all along. Sometimes they get cooperation from villagers. Sometimes villagers are not at all interested. And by way of change agent, because they are from the communities themselves. So communities, they have more faith on those change agents or those workers rather than our workers. So basically, this is the intermediary between community and our government machinery. So this concept is excellent.
Each state and sometimes different districts gave the change agents a distinct name. They were called Sakhi in Uttar Pradesh, Mitanin in Chhattisgarh, Pragati Mitrulu in Andhra Pradesh, Sarathi in Orissa, Parivartankari in West Bengal. For the Rachna program staff, the beginning was quite exciting. This presented opportunities to interact directly with communities and learn about issues firsthand. Train enthusiastic volunteers, handle mind-boggling numbers, and look forward to exciting and meaningful roles that change agents were expected to play. Thousands of change agents were recruited and then trained. The enthusiasm was contagious.
सर्वप्रथम तो हम लोगों को ट्रेनिंग दी गई केयर की तरफ से कि इसके बारे में सखियों का हमें चुनाव करना है केंद्रों से, मतलब कम से कम एक केंद्र पर 4 सखियों का चुनाव करना है, 4 या 5 हो सकती हैं। और उसकी पूरी जानकारी हम लोग को दी गई कि क्या सखियों को क्या करना है और कैसे उनका चुनाव करना है।
गांव में कोई ऐसी महिला हो जो मतलब जिसकी सब बात मानते हो, तो मतलब लीडरशिप हो एक तरह से उसके अंदर, या हमारे महिला मंडल की सदस्य हो या कोई बीडीसी मेंबर हो, कुछ भी वो प्रधान हो, वो रह सकती है जिसकी सब बात मानते हो और वो अच्छे से समझा सके।
फर्स्ट राउंड में उनको गांव में कैसे जाके बात करना है, कैसे परिवार को आइडेंटिफाई करना है, कैसे स्वाकलन के माध्यम से गर्भवती महिला को समझाना है, आयरन टैबलेट के बारे में कैसे जानकारी देनी है, आपका एक 15-20 महिलाओं के बीच आपका फोकस कैसे रहेगा।
फिर उसके बाद उनको काम सौंपा गया। काम उसमें ये सौंपना था कि उसमें कार्यकर्ती का सहयोग भी उनको करना था, कि जो जानकारी कार्यकर्ती दे रही है केंद्र से संबंधित, गृह भ्रमण में परामर्श दे रही है, वही सारे काम उनको भी बताए गए कि आप भी बीच बीच में जाके अपने अपने पूर्वे में, क्योंकि कार्यकर्ती पूरे गांव को कवर कर रही है, पर एक वो चेन एजेंट जो है वो अपने अगर एक पूर्वे की है तो उसकी बात का ज़्यादा प्रभाव पड़ सकता है उसी गांव की आस पड़ोस की रहने वाली है।
जो कि मितानिन अपन गांव में रह के पड़ोस घर बैठे जाथन, एक मितान के तरीका ओकर घर जाथन तो हमन दुख सुख लगोठियाथन, का सब्जी खाए तोनल जानथन और काला बुखार आगे तोनल जानथन।
तो वो लोग भी अपने 20 से 25 घरों में अच्छे से मतलब जान पाती थी कि कहाँ गर्भवती महिला है कि नहीं है। जाके फिर हमारे जो आंगनवाड़ी केंद्र पे एक बार मीटिंग होती थी, उसमें लोग आती थी और अपने अपने क्षेत्र की 20-25 घरों में वहाँ पर क्या समस्या है, कोई बच्चा पैदा हुआ, कोई गर्भवती नई महिला है, उसकी पूरी जानकारी देती थी।
This was growing into an ambitious movement aimed at delivering critical information and services to a widened population base. An effort to cover new ground like never before.
In Chhattisgarh, we are running one of the largest community volunteers program. We have 60,000 Mitanins in the state. It is one of the largest program run in the whole world. The Government of India has adopted this model under the National Rural Health Mission as a flagship program.
The change agent's role was voluntary. She was to be inspired by a sense of responsibility towards her community.
हम उनको ये समझाते हैं कि आपको भले मानदेय या कुछ नहीं मिल रही धनराशि, लेकिन इतनी जानकारियाँ आपको ट्रेनिंग के माध्यम से, जैसे आप लोग घर से बाहर नहीं निकलते थे, आप लोग को ये नहीं पता था कि कहाँ पे क्या हो रहा है, लेकिन आपका फ़ायदा सबसे बड़ा ये हुआ है कि आपको इस रूप में लिया गया कि आप चेन एजेंट बनाई गई और गाँव में आपका महत्व भी लोग जानेंगे, आपको पहचानने भी लगेंगे।
Executing the change agent strategy effectively proved to be a mammoth task. Over 200,000 change agents were identified, trained and supported, reaching approximately 51,000 villages by the end of the program. Classroom training was relatively brief, about 6 to 9 days, in 3 phases over 6 months in batches of 20 to 30 each. But for CARE, that still meant substantial effort over much of 2003 and 2004. Training modules were adapted locally in every state and district to suit local dialects and customs and different trainer backgrounds. Trainers of change agents were mostly small teams of ICDS and health program staff at the block level, specially trained for the purpose. Local NGOs were also extensively involved. At the end of each round of change agents training, Anganwadi workers and at places ANMs joined in for the last few hours to plan field work and coordination. This entire process of training and capacity building was funded by the Rachna program funds provided by USAID. The response of the ICDS and health systems to change agents was and continues to be very enthusiastic.
There was a need to have 2 workers, one looking after nutrition sector and another on the health sector. So there was a need, and I think this is in a very right direction that we have reached to the lowest most strata of our rural population.
जब बच्चा पेट में आया, रजिस्ट्रेशन कितने समय में हो जाना चाहिए, ये सब लोग जा कर के बताने लगी, तो लोगों ने इस पर ध्यान दिया। अभी जल्दी रजिस्ट्रेशन होने लगा है। ये बताती थी कि किस घर में किसके बहू इस समय गर्भवती हुई है, किसकी डिलीवरी करीब हो रही है, किसके यहाँ टीका लगना है, ये सब यहाँ आकर के लोगों को बता देती थी। ऐसे पूरे गांव में खोजना पड़ता था कि किसके यहाँ गर्भवती है।
Change agents were also expected to play roles as catalysts to overcome social barriers that existed in their communities.
अरे बहुत डांट दी हैं मुखिया जौन घर कर रही हैं, इतना डांटे कुछ कहा कि नहीं।
जो जाओ समझावे तो कहा अरे तुम बड़ी चौधराइन बनी है, दुनिया के ढोंगा सुन आया यहाँ आई है, कानूने बताती है कि चलो टीका लगवा लियो दुल्हन इनके, नहीं तो यह हो जाए, काने हो जाए, लंगड़े हो जाए, लूले हो जाए, यही सब कहा।
Innovative mechanisms were evolved to overcome resistance. For example, in several states, change agents brought mothers in their 7th month of pregnancy to the Anganwadi center to participate in the God Bharai ceremony. Here they were initiated into preparing for a safe childbirth before some of them left for their parental homes to deliver.
और जो ये आयरन टेबलेट है, ये आयरन टेबलेट हर गर्भवती को हमारी
Many states adapted an equally elaborate traditional ceremony, Annaprashan, for promoting the start of complementary feeding. As part of this ceremony, mothers with their 6-month-old infants were invited to the Anganwadi center, where they were felicitated. For instance, a traditional sweet preparation made of foods recommended for infant feeding might be made specially for the occasion. At places, the village leaders, the sarpanch and other members of the panchayat were invited to offer the auspicious first spoonful to the 6-month-olds. The children thus underwent a smooth and timely transition from exclusive breastfeeding to semi-solid complementary foods. Such measures provided much-needed social sanction for departing from age-old customs.
मितानी लोग घर घर पहुंचकर स्वास्थ्य के प्रति जागरूकता लाते हैं और हमको भी बताते हैं कि क्या समस्या है, तो हम भी अपने स्तर पे उसे दूर करने का प्रयास करते हैं और जो नहीं समझ रहे हैं उन्हें हम भी समझाने की कोशिश करते हैं और इसी कारण अच्छा प्रगति हुई है।
Inspired by the remarkable ground it had covered in a limited time span, the movement at places launched into an even more ambitious sphere. The transition of community volunteers from change agents to community leaders. Facilitated by the 33% reservation for women in the panchayat bodies, numerous change agents across some of the intervention areas were now encouraged to become active members of the local governance and soon found themselves elected to the panchayat. Some even became the village sarpanch.
With the help of CARE, I think Chhattisgarh was the first state in the whole country which brought in the health and nutrition as agenda of the Gram Sabha. We have the Gram Sabha. So Gram Sabha where all the people gather and the health and nutrition issues are being discussed.
अभी लोग जागरूक हैं। पहले उनको आंगनबाड़ी में क्या हो रहा है उनको ये नहीं मालूम रहता कि आंगनबाड़ी भी हमारे कार्य क्षेत्र में है, इसकी जो सेवाएं हैं ये हमारे कार्य क्षेत्र में, पहले ये सब चीज़ नहीं था। पर हम लोगों ने जितना अवेयर हमने समुदाय को किया है उतना ही अवेयर हम लोग ने पंच सरपंच को भी किया है।
To begin with, it looked like a small initiative, but it had long-term effects which we are now reaping the benefits of.
इतना है सर कि जब हम अपनी बातें उनको कहते हैं तो वो सुनते हैं, पहले सुनते भी नहीं थे।
Under the Rachna program, special emphasis was laid on developing strategies that would sustain change agents at large scale. Two important elements here were to promote community ownership of this initiative and provide strong system support.
हम अलग ज्ञान रही से हम जब हम मितानिन में आए गांव-गांव गए तो हम अलग ज्ञान मिल गए, चाहे गवर्नमेंट ये योजना चलाही या केयर संस्था वाला मन अपन प्रोजेक्ट चलावे न चलावे, मगर हमार गांव स्वस्थ बन जा रही तो हमार पीढ़ी दर पीढ़ी वाले अपना ही जैसे एक गांव गणेश के गांव मछली के माल पढ़ा देथन ओकर ज्ञान जिंदगी भर रहते, तो वैसने ये तरीका हमन अपनाए हन और दूसर ला ज्ञान देवत हन तो मन अपन पीढ़ी ले घलो बताही काबर अपन स्वच्छ रही तो अपन परिवार स्वच्छ रही।
It is a successful model which is available before us. The entire country has seen this. Even all our donor partners and the external agencies have seen this, including the World Bank people, the DFID, the European Commission, and they have all appreciated. And I think this successful model needs to be replicated and strengthened further.
The movement had now reached its peak and seemed all set to establish itself as a reliable, sustained and productive support mechanism for the public health system. A quick assessment of some of the earliest implementation sites revealed that change agents were indeed actively contributing. But in each case, they were intensely supported by local NGO workers and system staff. The concern was, how would these change agents perform if support was less intense when they went to scale? The answer came in at the end of 2004. This was at the peak of the change agents movement, when large numbers of change agents were already in place and the system functionaries were quite enthusiastic about them. The second round of annual household surveys was conducted in one district from each state. The findings revealed that in one crucial indicator, the change agents seemed not to have done too well. The surveys had asked mothers specifically as to who among Anganwadi workers, ANMs and change agents had visited them during pregnancy, the newborn period and in the month previous to the interview, and provided them information and advice about child care. Only 10 to 15% of mothers reported that they had been visited by anyone other than an Anganwadi worker or ANM. In each of these districts, the visits by the Anganwadi workers and ANMs were more numerous than those of change agents, quite the reverse of what was expected. The exception was Kanker in Chhattisgarh, where the volume of reported visits by change agents was comparable to that of Anganwadi workers and ANMs. In addition, change agents had also visited about 15% of pregnant women and newborn babies who had not been visited by either Anganwadi workers or ANMs. This performance appeared to be at least partly because of strong support from the state to the Mitanin program. On introspection, some of this was explained. The intensity of several processes could not be uniformly sustained at large scale, including the compliance to the envisaged selection criteria, the quality of training and follow-up support. Anecdotal experience also suggested that where change agents were contributing actively, it was because of the presence of a strong Anganwadi worker, and that where Anganwadi workers tended to be weak, so were the change agents.
It is such a large program with 60,000 Mitanins. They are contributing to the health issues, particularly mobilizing the community and working with them and staying in the villages. The biggest challenge is the sustainability of the momentum.
काम ज़्यादा बढ़ेगा तो इससे आप जब कम कर दें तो ऐसे जानकारी कम होगी हमका सबका, इसमें ज़्यादा हमसे मतलब जानकारी रहत रही, हमेशा हफ्ता हफ्ता भर हम जात रहे, सब भलकी बिगड़बो करे घरे को मरे लेकिन हमसे पहुँची ज़रूर।
तो हम लोगों ने थोड़ा सा कहा कि नहीं आप करिए वो करिए, तो हम लोग भी ज़्यादा प्रेशर नहीं दे पाए,
बैठक बैठक भी हम लोग नहीं ले पाए, ना ट्रेनिंग उनकी इस बीच हो पाई, थोड़ा सा हमारे उनमें बीच में गैपिंग आ गई, ये भी बात रही।
The functionaries in the field firmly believe, however, that change agents were very useful in bringing them information about mothers and children in their neighborhoods and bringing them in to avail of services.
In these 12 districts where care program is being run, results are very encouraging. In this program, change agents have played a very important role. So, and we feel that this concept of change agent should be replicated in other districts also.
In April 2006, the final evaluation of the program recommended that change agents should continue to be supported and that they continue to be seen as having an important contribution to make. What lessons might this hold for large-scale volunteer programs such as ASHA?
Selection, of course, is the most important part when we select that how dedicated or how sincere they are towards our duty.
In the whole country, there are more than 2 to 3 lakh ASHAs who have already been selected. And since we had some experience of selection of ASHA through the community, then training, now the challenge is to maintain the momentum that has gained, and we are finding it really challenging that how do we sustain the momentum.
What sustains volunteers is adequately intense ongoing support. This support base may come from within existing systems or beyond, but must be carefully cultivated and monitored. This is as crucial as the quality of the initial training. Keeping track of whether volunteer programs are meeting program objectives is crucial, particularly in the early course of the program. Through starts and pauses, we continue to learn. This is a movement towards hope or ASHA. As developmental partners, we all dig deeper in our efforts to bring empowered women from communities to positions that give them greater control over their own lives. The challenge is, can we do this quickly enough and meaningfully enough to create a measurable impact on the health of the people of these villages?